Tonight I'm going to talk and share my experience a little bit about exosomes in combination with energy-based devices. And as Dr. Gold was telling you, in the US we can really only use these topically, legally. And of course we all are very protective of our medical licenses. Like Michael, I work with a few companies. And I think he made the point, and made the point well, that exosomes are really messengers. It's not the particle itself that does the work, it's really the message that it contains. And if we look at how the message is transmitted, there are basically three mechanisms of action. One, of course, is paracrine, using the Wnt-Cadmium pathway. We also have the receptor ligand mechanism, and the old-fashioned way, you can get the exosome engulfed by the neighboring cell in a process called pinocytosis. So different ways to get the message across, but it's really the message that is important. Even more important, I think, is how we can clinically utilize this information, how we can drive outcomes. And because the way that exosomes work is that they do alter the genetic either transcription or genetic expression in the recipient area. So we need to create the optimal environment, and we've had a couple of presenters note that priming or preparing the treatment region to be a better recipient site is important, and I think we might forget this on occasion. We also, as a couple of our presenters noted, we really need to choose our exosomes widely. If it's pink, it's conditioned media, it's not pure, it's not exosomes, please don't buy it. Make sure that, Michael noted that we need to have purity, and I think this is more important than the supposed number of exosomes that you have in your vial. It's really how concentrated they are, and if you have filler or contamination, again, this will not be an effective product. So also, post-treatment, you need to repeat the message. If you put exosomes on once, it helps, but if you have a really good treatment of the recipient site that keeps those channels open for more of a message to get through, then this is another way that you can optimize your clinical outcome. As our previous presenters noted, we have now even more patents, and in the world, 8 US patents, and now we have an extra paper. Elena Shinobe and I just published the article on plant-derived versus human-derived exosomes, and as we're closing out the end of the year, we do have a study IRB approved coming up in the US, which is a prospective randomized split-phase study on human-derived versus plant-derived exosomes, and we're going to quantify the difference so everyone can know how much better one or the other is, or are they about the same? It's important to know also what is in your exosomes. We've been chastised as practitioners by putting exosomes on things when, the naysayers that maybe aren't on board yet are claiming that we don't know what's in them, and so therefore we should not use exosomes. I think ExoCobio is one of the few companies in the world who has been identifying what is in your exosomes. One of the most important things that Mr. Cho noted is that the microRNAs, especially the anti-inflammatory aspect of it, is what's important. And if we look at the family of master cell banks, there are 4 in the ExoCobio armamentarium, you'll see that the LET7B5P is probably one of the leading anti-inflammatory agents. We also have anti-scarring agents, we have anti-tumorigenic agents, and we also have some factors that will not only help with neoangiogenesis, but some of our clinical experience has noted that you can reverse ischemia. I'm a plastic surgeon. I've had a couple of people who had impending tissue loss that we were able to reverse with application of just topical exosomes. This is my patient, 54-year-old, who had metastatic breast cancer, and she was my first patient about 7 years ago. She came in to see me after a radiation burn, and she had had this condition for a couple of weeks, was not really responding to anything that was standard treatment, silver sulfadiazine, and she noted that the moment the exosomes touched her skin, all of her pain stopped. This was really a profound moment for me, because if you can stop somebody's pain, especially a breast cancer patient who was crying because this hurt and it was exquisitely painful every moment of every day, and you could give her a little bit of relief, then it was a really good feeling. So why did it work though? I didn't know at the time, but she had a compromised skin barrier. This let the exosomes in, so to speak. If you have an intact skin barrier, then exosomes don't really work so well. And so to me, we need a combination of inflammation at the treatment region. Otherwise, the exosomes would be preferentially filtered by the lungs. And you also need to activate the homing mechanism. What is the homing mechanism? It's something that we learned about when we were using stem cells. And stem cells go where the action is, so to speak. And if the lungs are inflamed, like they were in COVID, then that's why exosomes work so well. If we create inflammation, however, then your exosomes are going to work far better at your desired treatment region than if you just applied them. So this is why using this in combination with energy-based devices is important. So I wrote this chapter in clinics in facial plastic surgeries about 8 years ago, and we noted that microneedling or activating your topical biological with laser for laser-assisted drug delivery is a way to get the message through. How about non-thermal microneedling? How many of you do that? Skin pen, dermapen? A few of you. One of the reasons I don't really do it much anymore is because in order to get a result, you have to do a lot of it. And it creates not only a lot of bleeding, which will wash your topical exosomes away, but it also creates a pretty solid deformity. Most of my patients don't want to be red, deformed, or have a lot of pattern marks for a long period of time. However, if you wait about 10 minutes after your microneedling and let the area stop bleeding, clean it, apply your exosomes, and I really like the mask for this purpose because it really calms the reactivity, and then apply topical exosomes, your patients are going to heal much more quickly. Here's an example of non-thermal microneedling. Really close up, you can see a pretty significant improvement in blackheads and as well as a reduction of active acne. How about laser-assisted drug delivery? This patient, I think, had a really nice result after full field ablative erbium laser, and you can see her result after doing laser resurfacing and some stem cell therapy. To me, my experience, I've had my post-op recovery shortened by a minimum of 50% in time. But in a lot of our microneedling patients, the patients can walk out 2 hours later with no visible pattern marks and not even any erythema or temporary deformity. So here's how I do my RF microneedling, and all of us have a different technique. But I find, especially in the patient who has a darker skin type, I try to go a little lower on the power so you don't get that PIH that one of our previous presenters showed. So minimum power, more biostimulation, then ablation, and application of topical exosomes. And I send the patient home with Exobalm. My formula might be a little bit different than the commercial available product, but I'll have the patients do it 2 or 3 times a day until that exosome balm that they keep in the refrigerator is gone. So here's an example of my patient. Now, again, I'm a plastic surgeon, and so unless you totally get rid of the deformity, my patients are not happy. So this was a 23-year-old who had acne scarring all her life. She had some reds and some browns, and now she doesn't have to wear makeup anymore. So this was a really nice outcome, and I think this is something that most of us can achieve. What about hair? Now, Dr. Superrouge is going to show results that are far better than mine, but this to me is an example of the need for priming your recipient site. I have my patients take either finasteride or dutasteride, oral minoxidil, 2.5 to 5 milligrams a day. I will have them use a LED light or hair max comb at least twice a week. They take hair vitamins like Viviscal and use a biotin shampoo. And then on top of this, we like to do radiofrequency microneedling treatments at least once a month for 3 months. And they do tend to need to come back every year. But this is a patient who's had 2 treatments and has not come back for any treatments other than a recheck so that I can give him his finasteride. His results have lasted without a need for maintenance treatment now for 3 years. What about women? Most of the slides we've seen so far in the exosome field have been men. But the ladies have, at least 40% of the women in America have thinning hair and would pay somebody to make their hair thicker. So this woman wore a ball cap at all times because you could see her pink scalp. And I started her out with priming the area like I just talked to you about. In the ladies, I tend to use dutasteride instead of finasteride. And she got 3 treatments of radiofrequency microneedling and topical Benev exosomes. And I saw her maybe just last week, and her hair looks even better than it did in this picture. What about PCOS and hormone-related hair problems? This is a tough thing to treat. This patient is 38 years old. She said she's always been bald on top and was very, very self-conscious about ever showing the top of her head. So she came in for her prescribed 3 treatments. I sent her to a specialist who could really optimize her hormones because PCOS patients have a lot of endogenous testosterone and they need to fix that before they go on to have their hair treatments. Here she is at 3 months post-treatment and wants, yes, even more hair. What about combining energy-based devices for the treatment of body problems? This is not something that you commonly see. So the device I used here was a combination of M-Sculpt Neo and the M-Tone, and the treatment region is circled in red. If you look really closely at her pictures, you'll note that immediately after her last weekly treatment, at 4 weeks, her bra roll was reduced and her skin quality was better. And when she came back to see me at 3 months, I was really shocked because it does look like this picture has been photoshopped. I'm old, I don't know how to Photoshop, but this area, and you'll note that her skin looks so much better all over her abdomen, not just in the treatment region, and that's because she put the Exobalm all over her skin. So a little bit of localized inflammation. You'll see what we call recruitment of adjacent tissue as far as the treatment results, and you can get some pretty remarkable improvements in skin quality, even though it's not exactly in the area where your energy-based device was. What about weekend treatments? Probably a lot of you have patients who work and they don't really have time for downtime. They want to come in on a Friday, have a treatment, look great to go out Friday night, enjoy their weekend, and go back to work on Monday, be on a Zoom call, and have no evidence of having been in your clinic. So this is a treatment that I borrowed from one of my Asian friends, Achima Suachinda, and she does a lot of microtoxin. It's not so much of a thing in the US, but it is coming soon. So I treated this patient with a little microtoxin, some slightly dilute HA in the infraorbital rim, and microneedling and exosomes. And you can see the change in her skin from Friday to Monday is pretty remarkable. She has no residual pattern marks of any kind. So this is our article. I hope that you guys will consider taking a picture of the QR code, because then you can read it yourself. So Dr. Theodora Kopoulou, Shino Bay, and I wrote this article recently published in ASJ Open Forum. And basically what we're concentrating on in this particular study is facial dyspigmentation. With our new study coming up, we're going to be looking at many other things, including reds, browns, skin brightness, pore size, and deviation from the mean of a baseline for wrinkle index, so that we can really quantify, using this split face study, the exact numeric value that exosomes add to our skin. If we look at the proposed mechanism of action, and this is basically plant-derived, because in Europe you can't use human-derived, and we'd be looking at everything from improved angiogenesis, balanced inflammatory pathways, and regulation of melanin synthesis. So in my field, our overall goal really primarily are results. And the results, part of the results is that the treatment has to be economical and comfortable with little to no downtime. So I think in conclusion, it's really important to know that unless you have an existing inflammation or your treatment recipient site has been primed or treated, you're probably not going to be able to optimize your outcome. You can't inject in the US. We want you to choose top grade purified exosomes, and the derivation does matter, but I think that the plant-derived or ASC exosomes you're going to find are very, very good. Thank you so much.